If you cannot put on your shoes in the morning, the problem is not just swelling. Your heart, kidneys, or liver may be silently calling for help. Morning foot swelling is very common in older adults. Most people consider this normal. But after 65, morning swelling can be a sign of one of 4 serious diseases: heart failure, kidney failure, liver disease, or venous insufficiency. Don't forget to like this video and subscribe to Health Memory, because what you learn today could save your life with early diagnosis. What is edema, and why does it occur in the morning? Edema means excessive fluid accumulation in the body. When it collects in the feet, it is called peripheral edema. So why is it more noticeable in the mornings? When you lie down at night, your body is in a horizontal position. The effect of gravity decreases. Fluid distributes evenly throughout the body. When you stand up in the morning, gravity comes into play. If your heart, kidneys, or veins are not working well enough, fluid begins to accumulate in the feet. Mild swelling can occur in normal aging too, but swelling in serious diseases is different. Finger marks remain, shoes do not fit. It happens every day. It comes with other symptoms. The first and most serious cause is heart failure. The heart cannot pump enough blood. Fluid accumulates in the legs. Robert was 22 years old. For the last 3 months, he could not put on his shoes in the mornings. He thought it was normal for himself. He said it was old age. But one morning, shortness of breath started. He could not climb stairs. When he came to the emergency room, heart failure was diagnosed. His heart was working at only 30% capacity. How does swelling occur in heart failure? The heart pumps weakly. Blood flows slowly. Venous pressure rises. Fluid accumulates in vessels. Fluid leaks into tissues. Edema forms in feet. After 65, heart muscle strength decreases. Valves wear out. Coronary arteries narrow. Heart rhythm disrupts. What are the other symptoms of heart failure? Shortness of breath, especially when lying down. Nighttime cough, fatigue, rapid weight, gain 2 to 3 kilos in 2 to 3 days, loss of appetite, abdominal swelling. How did Robert's condition progress? Medication treatment started, salt restriction was done, water tracking was initiated, regular control was provided. After 3 months, swelling decreased, shortness of breath improved, quality of life increased. The second serious cause is kidney failure. Kidneys cannot eliminate excess fluid. Water accumulates in the body. Margaret was 68 years old. In the mornings, not only her feet but also her face was swollen. Especially her eyes were swollen. Her urine decreased. Constipation started. When she came to the hospital, kidney function had dropped to 25%. How is swelling different in kidney failure? Not only feet, but face and hands also swell. Morning facial swelling is noticeable. Urine amount decreases. Urine may be foamy due to protein loss. Skin is pale and itchy. How does kidney function change with age? At 60 years, 100% function. At 70 years, 70 to 80% function. At 80 years, 50 to 60% function. Diabetes and blood pressure rapidly wear out kidneys. How was Margaret's treatment? Protein restriction was done. Salt was reduced. Water balance was controlled. Blood pressure medications were adjusted. Dialysis was not needed, but close monitoring continues. The third serious cause is liver disease. When the liver cannot produce albumin, fluid escapes into tissues. Thomas was 70 years old. He had been a hepatitis carrier for years, but did not know it. In recent months, not only his feet but also his abdomen started to swell. Abdominal fluid known as ascites was accumulating. Liver cirrhosis was diagnosed. How does edema occur in liver disease? The liver cannot produce albumin protein. Blood proteins drop. Oncotic pressure decreases. Fluid cannot be retained in vessels. Fluid accumulates in abdomen and feet. What are the other symptoms of liver disease? Abdominal swelling ascites, yellowing of skin, spider veins on skin, red palms, bruises appear easily, fatigue, and weight loss. How did Thomas's treatment progress? Diuretic treatment started, low-salt diet was applied, protein support was given, ascites fluid was drained. He was placed on liver transplant list. Quality of life improved, but close monitoring is needed. The fourth cause is venous insufficiency. Valves in leg veins are damaged, blood flows backward. Helen was 69 years old. She had varicose vein problems for years. Recently, ankle swelling increased. Brown spots formed on her skin. Sometimes she felt itching and pain. Venous insufficiency was diagnosed. How does swelling occur in venous insufficiency? Valves in leg veins are damaged. Blood is not pumped upward. Venous pressure increases. Fluid leaks into tissues. Swelling occurs especially in ankles. How does venous insufficiency develop? With age, vein walls weaken. Valves lose elasticity. Standing for long periods is harmful. Sedentary lifestyle increases risk. Obesity puts pressure on veins. How was Helen's treatment? She wore compression stockings. She did leg elevation exercises. She started regular walking. She lost weight. Heavy vein medication was started. Swelling decreased by 70%. How do you distinguish swelling types? Heart failure swelling, both feet swell equally. Finger marks remain. Shortness of breath accompanies. Gets worse at night. Kidney failure swelling. Face and hands also swell. More noticeable in morning. Urine decreases. Skin becomes pale. Liver disease swelling. Abdomen also swells. Skin may be yellow. Fatigue is very noticeable. Venous insufficiency swelling, usually one-sided. Skin changes present. Varicose veins visible. Gets worse in evening. How do you test yourself at home? Do the finger mark test. Press on the swollen area for 10 seconds. If a pit remains, there is serious edema. If it fills immediately, mild edema. If there is pain when pressing, there may be venous problem. Do the shoe test. If your shoe is hard to put on in the morning, there is a problem. If it gets even harder in the evening, it is serious. If you experience the same problem every day, go to the doctor. Do weight tracking. If you gain 2 to 3 kilos in 2 to 3 days, there may be a heart problem. Rapid weight changes are a sign of fluid accumulation. When should you go to emergency? Sudden severe swelling started. You cannot breathe. There is chest pain. One side is swollen and there is pain. Suspicion of clot. No urine for 24 hours. Confusion started. There is high fever with swelling. If any of these symptoms exist, call 911. What are the diagnostic tests? Blood tests are done. BNP test for heart failure, creatinine and BUN for kidney function, albumin for liver function, complete blood count for general condition. Imaging tests are done. ECG for heart rhythm, echocardiography for heart function, kidney ultrasound for kidney structure, Doppler ultrasound for vein structure, chest X-ray for lungs and heart. Urine test is done. Protein presence shows kidney damage. Urine density shows kidney function. What are the treatment options? Heart failure treatment, diuretics, water pills. ACE inhibitors reduce heart load. Beta blockers regulate heart rate. Salt restriction 2 to 3 grams daily. Water restriction 1.5 to 2 liters daily. Regular weight tracking. Kidney failure treatment. Blood pressure control is very important. Protein restriction may be needed. Potassium and phosphorus balance. Dialysis in advanced stage. Kidney transplant option. Liver disease treatment. Diuretic treatment. Low-salt diet. Protein support. Ascites fluid drainage. Liver transplant in advanced stage. Venous insufficiency treatment. Compression stockings. Leg elevation exercises. Regular walking. Weight control. Surgery in severe cases. Ways to reduce swelling at home. Elevate your legs. 3 to 4 times daily for 15 to 20 minutes. Keep above heart level. Put under pillow when lying down. Reduce salt. Maximum 2 to 3 grams daily. Avoid processed foods. Cook fresh meals. Use spices instead of salt. Balance water. Both drinking too much and too little is harmful. Drink the amount your doctor recommends. Generally, 1.5 to 2 liters is enough. Move regularly. Sitting increases swelling. Get up and walk every hour. Do ankle exercises. Regular walking is best. Wear compression stockings, especially for venous problems. Put on in morning, take off in evening. Choose correct size. Use with doctor recommendation. Control your weight. Excess weight puts pressure on veins. Every 5 kilos increases swelling. Lose weight slowly and healthily. Do or get foot massage. Massage upward. Improves blood flow. 10 to 15 minutes daily is enough. Avoid hot water baths. Heat dilates vessels. Can increase swelling. Prefer lukewarm shower. Avoid tight clothing, especially at waist and legs. Blocks blood flow. Prefer comfortable clothes. Go for regular checkups. Monthly swelling control. Blood test every 3 months. Echocardiography once a year. Early intervention saves lives. Nutrition recommendations: eat balanced potassium. Too much potassium is harmful for kidney patients. Too little potassium is harmful for heart patients. Ask your doctor how much you should take. Maintain protein balance. May be restricted in kidney patients. May be increased in liver patients. Should be personalized. Take magnesium. Green leafy vegetables. Nuts. Whole grains. Reduces muscle cramps. Balance vitamins. B vitamins are important. Vitamin D for bones. But uncontrolled supplements are harmful. Take under doctor's supervision. Pay attention to drug interactions, pain relievers. NSAIDs can cause swelling, especially ibuprofen, diclofenac. Risky in kidney and heart patients. Prefer paracetamol if possible. Some blood pressure medications cause swelling, especially calcium channel blockers, like amlodipine, nifedipine. Discuss with your doctor if there are alternatives. Corticosteroids cause swelling, like prednisone, with long-term use. Use at lowest possible dose. Patient success stories: Michael is 70 years old. After heart failure diagnosis, he started treatment. He restricted salt, used his medications regularly, weighed himself every day. After 6 months, swelling disappeared, shortness of breath improved, returned to normal. Susan is 68 years old. Her kidney function was low. She reduced protein, controlled her blood pressure, got regular follow-ups. She did not need dialysis. Her functions remained stable. Frank is 73 years old. He had venous insufficiency. He started wearing compression stockings, lost weight, walked regularly. Swelling decreased by 80%. Quality of life increased. Morning foot swelling is not normal. Especially after 65, it can be a sign of 4 serious diseases. Early diagnosis saves lives. What you will do starting tomorrow. Look at your feet every morning. Do finger mark test. Weigh yourself daily for weight tracking. Reduce salt to 2 to 3 grams maximum. Move regularly. If swelling lasts more than 2 weeks, go to doctor. Emergency signs. If you see sudden severe swelling, shortness of breath, chest pain, no urine, call 911. Your body is talking. Listen. Small signs can be harbingers of big diseases. Healthy life is possible with early intervention. Share this information with your loved ones. Like the video and subscribe to Health Memory Channel. Wishing you healthy days. Take good care of yourself.